A good candidate for a penile implant is somebody who wants the most rapid and reliable treatment option for their erectile dysfunction. Most of these men have already failed some other less invasive type of treatment option. Other factors that are important for determining a good candidate for this procedure is that if they're a diabetic, that the diabetes is very well controlled. Also, smokers should quit smoking. The penile implant procedure is covered by nearly all commercial insurance providers, as well as Medicare. We always make sure before the procedure that any insurance issues are cleared up so that you don't get stuck with an unexpected bill. In the United States, we have 3 different categories of penile implants. Malleable devices, which are basically bendable rods, and then inflatable devices, of which there are 2 different varieties: the 2-piece inflatable and the 3-piece inflatable device. The malleable device maintains the same rigidity at all times. The device can be bent up or down depending on whether or not you want to use it for sexual activity or whether you want to conceal it. An inflatable implant, on the other hand, is controlled by a pump that you pump between the testicles that causes the device to become rigid. That device maintains its rigidity until you press a release button down on that same pump in the scrotum. That allows the device to deflate and moves the fluid from within those cylinders into a reservoir or balloon that's hidden behind your belly wall muscles. During the procedure, we measure the internal space that normally fills with blood for an erection and determine the appropriate size of a penile implant. We always use the largest device that can fit in this space without causing damage. In order to operate the penile implant, you feel down in the scrotum between the testicles for a 3rd spherical object. This is the pump. You squeeze the pump and fluid moves into the cylinders inside of the penis shaft. Those fill up until they're completely rigid. You cannot overinflate the device. Keep squeezing it until the device is completely inflated and it doesn't allow you to fill it anymore. This will then maintain its rigidity until you're done with it. Then you can bring it down by squeezing the release button just above that same pump. This will allow the fluid to run back out of the implant and into the reservoir that holds the fluid in the belly wall until you're ready to use it again. It's really important for patients to know that the penile implant does not affect ejaculation, sensation, orgasm, or urination. It simply provides hardness to the penile shaft on demand whenever you want it. The penile implant is very concealable. I always tell men that if they were to undress at the gym and somebody were to see them from across the room, they would never have any idea they'd had something done. Now, in the first few weeks and even months after the procedure, there may be slightly more protrusion until the device softens with uses over many times, but then it'll lie naturally like a normal penis. The implant is made of a soft material that inside of it contains salt water. It doesn't have any metal in it. It's not going to set off any metal detectors or MRIs or anything like that. The solution inside of the implant is just salt water. We call it saline. That means it's the same concentration of salt as is found in the rest of the body. If for some reason the device were to leak some of this fluid out, it would not harm you in any way. The penile implant is a 1-hour outpatient procedure done under full general anesthesia, meaning you'll be totally asleep and you won't remember a thing. We start by making a small incision about 3 centimeters on the front of the sac. We don't make any cuts on the penis. Through that, we're able to place the complete penile implant. And at the end of the procedure, we close everything up with dissolvable stitches that you will not need to have removed. We oftentimes will leave a temporary drain to collect leftover fluid from the procedure that's typically removed the next day in the office. While you're asleep, we'll also drain your bladder with a catheter. And generally, almost always, we can remove this before you wake up from anesthesia. The recovery period really varies from patient to patient. In general, for the first 3 days, I recommend taking it easy with your legs elevated, laying on the couch. This will help prevent swelling, which will reduce your pain. For 2 weeks after the date of the procedure, no heavy lifting over 10 pounds. That's about a gallon of milk. After the procedure, we wait 4 weeks before teaching you how to use the implant. This makes sure that the incision has completely healed and that any discomfort surrounding the incision will not interfere with your ability to operate the pump. As far as how long the penile implant lasts, I've seen many men who've had the device for over 30 years and still use it regularly. However, in general, the risk of having to have the device replaced within 10 years is about 15%. This typically happens because the tubing that connects the components might crack and allow some of the internal salt water to escape. You may notice that the device doesn't get as hard as it used to, or that the device will not inflate at all. This is a reason to replace the device. Satisfaction rates for the penile implant generally range from about 88 to 98%. When we've polled the female partners of men who have had a penile implant, their satisfaction rates are similar, also roughly 92 to 98%. The potential risks of a penile implant procedure include mechanical failure or breaking of the device. The risk of that happening after 10 years is about 15%. Another risk of the procedure is infection. Thankfully, this risk is quite low. Only about 2 to 5% of patients will develop an infection. This always requires the device be removed and is more common in men who are diabetic. We have a full antibiotic protocol that we follow with antibiotics before, during, and after the procedure to help prevent this from happening. In addition to these risks, there's also a risk of further loss of length from the implant. In general, this should not be more than about 1 centimeter. Most of the perceived length loss that happens with the implant is actually just length that's already been lost from many years of erectile dysfunction. Finally, the risks of anesthesia, which are very rare but can include heart attack, stroke, and blood clots.